Welcome back. Welcome back to Speak Your Truth with Charlie. How are my truth seekers doing today? So, this is going to be a moment of transparency, as I normally am very transparent with you guys. And I want to get into some things that I've been seeing in the media about Ozempic and give you my personal experience about Ozempic as well. Okay, so let's get into it, shall we? So I have been taking Ozempic now for about 11 months, and I have my notes over here, so you're gonna see me looking at them because I want to be as accurate as possible. So about 11 months now, and if you're not aware of Ozempic, a lot of people are using it as a weight loss injection. Okay, that was one of the reasons that I started using it, but the other reason was that I have a situation in my body right now where it's producing insulin. If you've never heard of that, they say it happens once in a million. So when I got blood work back, I have went to this particular doctor. It's a preventative health doctor because I just felt like things were off, and she did a whole course of blood work, which most of my other doctors have done in the past, but no one came back with those findings, and she was the only one. And since then, she's left the practice. But anyway, getting back to the main point is that she found out that it was 28% of insulin in my bloodstream. I don't take insulin. I don't have sugar diabetes or any of that. So it was just like, what? Never heard of that. And so that was one of the main reasons that I started taking Ozempic, because they said that that could possibly decrease the insulin level that I was having in my system, right? Well, I've been on it 11 months and it hasn't decreased anything. So now we're going to be switching to Mounjaro, and I don't know if you heard of that particular injection. And according to them, the doctors, it's less side effects, and it also goes up to 16 milligrams. So you have a level of increase. If the lower milligram level is not working for you to lose weight, you could go higher and higher, right? But the other thing too is we're hoping that that will help with my insulin decrease, right? And let me just tell you something else, right? The doctor told me that if I was to take insulin, right? Because I have 28% of insulin in my system, if I was to actually take insulin, or somebody was to give me a shot thinking that I had, diabetic coma or something, that it would be deadly for me. Isn't that crazy? When she told me that, I was like, what? And all this time, I'm 47 years old. This is the first time that I'm ever finding that out. And it's like, I've been basically skating by all this time, because what if somebody had done that? That could be a reason for me to lose my life. And I just thought that was, crazy. And no other doctor has brought this up thus far. And so, yeah, I just wanted to have a moment of transparency with you guys and just kind of tell you what I've been experiencing, okay? So over this 11 months, I never said anything to my doctor when I first started with the Ozempic, right? But the nausea started right away. I had nausea tremendously, and it was every day. I want to say the first month it was every day nausea. And I want to say the first 2 to 3 weeks was the puking. I had to do that often. And I didn't tell the doctor that I was having those kind of problems, because I was like, you know how we are. I'm just like, I'm going to tough it out because I want to see some weight loss. And I also want this insulin to go down in my bloodstream. And so I'm just going to tough it out. So that's what I did. I toughed it out. I didn't actually tell her, the newer doctor, I didn't tell her until probably about a couple months ago that, I was throwing up in the beginning. And she was like, well, you got to tell me those kind of things. So don't do what I did. That's the whole point of me bringing it up. If you have a situation where you're throwing up and whatnot, let the doctor know so that they could switch you to something else. But, weight loss has been a struggle for me. And a lot of the reasons, like me having the insulin in my body, is what the doctor was saying that has been slowing down my metabolism and not allowing me to lose weight either, because I really cut out so many different things that I ate. And so I was like, why am I not seeing the production, And a lot of times when I would go to the doctor, it's like I'm gaining 2 to 3 pounds, and I'm just like, why? You know what I mean? Because I'm doing everything on my end. Needless to say, that's one of the reasons too that I was unable to lose weight. Well, I'm happy to say that as of yesterday, I'm at 56 pounds lost. Okay. And that has been within the 11 months. So that has been the production with the Ozempic for me, right? And I know for different people, you're going to have different results, right? And it could be as far as how you're eating and whatnot. For me, I changed my eating habits 100%. I had to make sure that now I was counting calories. Since I know that I am losing weight continuously, one of the things, I didn't have a scale in the house. So I would only wait until I go to my doctor's appointments, which hence I had a doctor's appointment yesterday. And so I was weighed again. So whenever I adjust in my weight, I put it on, let's see. I normally take a picture now. Whenever I weigh myself, I take a picture so I can see how I'm looking, right? But I also make sure to, let me see, I'm going to show you guys. I have my Fitness Pal. I don't know if you can see that. See, and they got my little picture. They got my little picture up there, right there. So I have my Fitness Pal. Anything that I'm eating, I put in there as well. My calories for the day. I do like a journal in my Fitness Pal. But anytime I weigh myself at all, then I put that in there with a picture. So until the next time that I weigh myself. But I do plan, okay, because we're in the month of October, right? So I do plan on getting a scale now, because now I think I can handle, the outcome when I see it. You have to know mentally what you can handle. And at that time, I don't think I could. I hated to get on the scale. Now when I go to the doctor, I'm like jumping on the scale, to be honest with you, because I'm like, what did I do this time? What did I do this time? So yesterday it was 6 pounds I lost. So I'm at 56. I've, feel like in another week or so, I should be at 60 pounds lost. That's what I'm hoping, because lately it's been between 2 to 4 pounds a week, right? Lately. Now, when I started in the beginning, it was probably a pound a week. I want to say like 3 months later, I started seeing like maybe 2 pounds a week, right? And lately, because I have a little bit more energy now, and so, you know, I'm walking a little bit more and whatnot too, even though right now I can't exercise because of my prolapse situation. The doctors told me not to be exercising. But when I get that situation taken care of with my surgery, then I could go back to exercising, right? So I do walk and whatnot, and I'm very active because, you know, I have several businesses, so I'm always on the go doing something, right? And so right now I'm at, again, 56 pounds lost total. So I'm saying by next week, that should be at 60 pounds lost. And so I always try to give myself a measuring stick, I guess you could say, as far as where I want to get to. And my body mass right now is at 45 BMI. And so I was told that once I get it to 35, which my doctors have already put it in with my insurance, and it will be approved for me to get skin removal and cosmetic surgery as well, if that's something that I want. So we'll see as the time progresses, and I will keep you guys informed as far as that as well, because I want to be completely transparent for anyone that might be dealing with what I'm dealing with right now as far as like weight loss journey, and, you know, seeing what your options are. And then you can also probably check into the Mounjaro as well and see if that's something, if you're taking Ozempic and having some issues. You know, always check with your doctor, because I'm not a doctor, but I do want to be relatable and, you know, let you guys know my journey and something that you could do as well, okay? So when we get to that point, I'm going to try and see if my preventative medicine doctor would possibly come on camera so I could share all that with you guys. Maybe like when we have a doctor's appointment, you know, I'll show you guys me weighing myself and all of that and get more in detail, because I know that is a situation for most women that we're dealing with constantly, especially after childbirth. You know what I mean? It's really hard to get those pounds off or whatever. And I think the last few years it was harder for me because, you know, I lost someone. Those of you that didn't see my previous video, my boyfriend committed suicide. So for me, it was, I didn't really want to go out a lot, and I was dealing with my own type of depression and whatnot, and probably food at that time was, you know, closer to me, you know what I mean? It made me feel good. And it was a picture that just came up about 2 years ago. Well, it just came up this past week, a Facebook picture, you know, and that's why it's good to have memories, right? And that was 2 years ago. And when I tell you, my face was so bloated, and like, I didn't even really recognize myself when I saw the picture. And so I'm probably going to post it on this particular video so you guys could see the difference. And I'll probably take a picture today so you can see that as well. But yeah, it's really good when you're going through this weight loss journey that you're taking pictures, and so you could go back and you could see, you know. And if you download this app, this fitness app, like I said, every time I go to the doctor, I make sure to take a picture the day that I weigh myself. So if you're doing it at home, you're doing it once a week, take a picture and then put it in your phone and then save that on your app, because then you could go back and look at it. Okay, that's just a FYI if that's something that you want to do. And even when I started with this fitness app, I had a goal of where I want my weight to be. And when you put that in, right, then it'll tell you like basically how many calories you're supposed to have per day in order to attain that goal. If you want to lose 2 pounds a week, like I did, right, then you put that in your fitness app and it'll tell you how many calories you're supposed to have per day in order to obtain that. So that was very helpful for me, and it could be helpful for you as well. But let's go ahead and get into the Ozempic. So they just sent me my box of Ozempic. Okay, this is the wrong one. This is what the 1 milligram looked like. Okay, but this is the wrong one that they sent me. Okay, so that's the Ozempic. This is the one that I take, and it's like a gold one. Okay, and this is the 2 milligrams. That's the one I take. So I'm gonna show you how this looks. We're gonna get into the things. So this is how it looks, right? Looks like a little pen. And this is a fairly new one. This will be my 3rd week. Today I take it. I normally take it on Wednesdays, and I'm gonna tell you something about that too. I used to take it on Fridays. The one time a week that I used to take it was on Fridays, right? And so this right here, you see it's at 0 right now, right? So you're gonna press that, and then you're gonna go ahead and adjust it. You see that click? And I want to get it to 2. And since I am taking this today, I'm gonna go ahead and put the needle on there so you guys could see as well. Okay, so that's the needle in there. You just go ahead and stick it in the middle. Turn it around until it's tight. Take that off. That's the needle. Can you see that? That's the needle right there. So I'm gonna put that back on because I'm not taking it right now. But you just keep turning this until you get it to 2. Okay, you see that? It's at the 2. So now wherever I'm gonna put it, every week I'm gonna put it in a different place on my stomach, right? So I don't know what this week is. I'm looking at the calendar because I put it every week. I put it for a different side of my stomach. Okay, so last week was the right lower part of my stomach, and then this week is the left upper side of my stomach, and then the following week will be the right upper side of the stomach. The right, because this week will be the left upper. So on this side of my stomach, I'll go ahead and put it, and the week after that is the left lower side of my stomach. So every week you're going to go ahead and change what side you put it on. So make sure to be detailed and write it down, because you will forget, so that you can make sure you're not putting it on the same side, because you don't want to do 2 weeks in a row on the left side of the lower part of your stomach. You know what I mean? They want you to change it up. So make sure that you're doing that. So this is the 2 milligrams here. And so this is what I'll take today. Okay. So I just wanted to show you that this is also my needles that I use, and these are way more comfortable than the needles that they give you. I found than the needles that they give you with the Ozempic pen. So if you want to check these out, my doctor, she prescribed these for me, so I get these at the pharmacy, and they're way more comfortable for me, because I was noticing too with the other needles, I was getting more bruising around my stomach area. So that prevents that from happening now with those other needles. And sometimes I'll even have my daughter to give me the shot, especially when it's a day where I'm more irritated. But what I was saying, and I'm gonna wrap up this video, is what I noticed is when I switched my days from Friday, because I work all week, right? And so when I would take the Ozempic on Friday, I think my body was so exhausted at the end of that work week that I was having all kinds of irritation. And a lot of times I would have stomach pain, I would have back pain, I would feel super duper nauseated and whatnot. And now the nausea, it comes and goes. I don't feel it as much as I did in the beginning. And I have a whole lot more better days than I did before, right? So the nausea is almost a non-factor for me. And now I do it in the middle of the week. So I take my shot on Wednesdays, and what I notice is that helps me quite a bit as far as having the nausea. I don't know why exactly, but when I switched my days, it was so much better for me. So if you're experiencing having a lot more nausea at the ending of your work week, maybe try to do it in the middle and see if that works for you as well. What I noticed too is eating before I took my shot. A lot of times I would eat after. So eating my dinner prior to me taking my shot and making sure that I'm hydrated as well helped me to be better off after I took the shot. And then I try not to do too much once I take the shot, just kind of like lay it down a little bit, which also helps, because sometimes you have burning too from the shot, a stinging effect, and you could feel that going into your system like right away. A lot of times I would feel it on my tongue. So I try to make sure to have fruit, if that makes sense. You know, you would feel like the medicine, like that medicine taste in your tongue. And so I would have fruit like, you know, watermelon, cantaloupe, honeydew melon, things like that, even blueberries. And, you know, so I could snack on to get that taste out of my mouth. Staying hydrated is another thing, because you will get dehydrated with the Ozempic. That was something that I was experiencing. Like I mentioned, back pain. Some of the other adverse reactions are nausea, vomiting, diarrhea. I had the diarrhea before I had the vomiting, like I told you earlier. Abdominal pain, you will get that. You will get constipated as well. So if you could get like a stool softener, that would help as well. So those are just a few of the adverse reactions that you might have. And again, I am going to be switching. I'm just waiting for my insurance to approve the Mounjaro, but it has already been sent. And as soon as that's approved, then I'm going to be switching from the Ozempic to that. But you know, I'm going to keep up with the Ozempic until they actually switch me over. So I'll keep you guys posted as far as that. But I hope that this information that I shared with you guys today was helpful. And another thing with the Ozempic, you got to keep it refrigerated, you guys. It's always supposed to be refrigerated. So make sure that you're keeping it in the refrigerator until you use it. So I will be putting those back into the refrigerator. And, you know, check with your doctor to see if you can get a prescription for it. You know what I mean? Normally it's used for people with diabetes, but now it seems to have a lot of other benefits as well. So not just for diabetes, like I told you guys, I have a situation with insulin in my system. So it's supposed to help to lower that, which it hasn't worked yet for me. So I'm hoping that the Mounjaro will help with that. But it's also, you know, something that helps with weight loss in addition to that, diabetes as well. I don't have diabetes. That wasn't an issue for me, but I noticed too when I was reading up some information, even pre-diabetics, they're giving Ozempic too, because maybe it's a hereditary type thing, and maybe they're overweight too. A lot of times when you're overweight, they figure that you might get diabetes at some point. So in losing the weight, you're helping to rectify that potential situation. So there are so many different things out here. You just have to basically read up on all of those things and see what works for your body, right? So I will be keeping you posted, and I'll be totally transparent, and I'll see if my doctor will get on camera with preventative medicine and take you guys through that journey as well, so that that can be helpful for those of you that are, you know, on your weight loss journey as well, and getting to, you know, those areas, you know, of concern, as it were, because, you know, when you're losing weight or on your weight loss journey, there are different steps to it, right? And so even with me, I get, you know, anxious about certain things. You know, just what I was telling you guys as far as like the skin removal. I've never been to that situation in my body yet. And so the skin removal, that's scary. You know what I mean? So, you know, being on this journey with me and seeing when I get to that point, you know what I mean? And if you're thinking about that, you know, me letting you know what that journey is all about will make it a little bit more easier for you to deal with, right? And so that's what this is all about. That's what Speak Your Truth with Charlie is all about, so that I can make it, if it's something I'm dealing with and it's something that I've been through, then I can share that with you, and vice versa. So I thank you guys for listening, and I hope that this video will be helpful to the masses. And until next time, bye-bye, everyone.